just say no. Kids are too smart for that. They want science behind that, why they shouldn't be doing it. These kids could get a hold of this and that it was such high potency. Talk to your kid. Don't sit down at the dining room table and say, now we're going to have a talk. For a safe, healthy, and drug-free community. Watch Step Up to Save Our Children today. Hello. Welcome to Step Up to Save Our Children, where we bring parents and caregivers the information they need to help kids make healthy, safe decisions. Today we're talking about an important connection that every parent of a child with attention deficit hyperactivity disorder, or ADHD, should understand. ADHD and the increased risk for substance use. Children and teens with ADHD may face challenges with impulsivity, emotion regulation, decision-making, and peer pressure. And these factors can sometimes put them at a greater risk for substance use and risky behaviors. My name is Denise Mayer, and I am your host at Step Up to Save Our Children. Joining us today is Pat Aussem, Vice President of Consumer Clinical Content Development at Partnership to End Addiction. An expert in prevention and family support, Pat is going to help us understand why kids with ADHD may face these added risks, what parents should watch for, and most importantly, what parents can do to help reduce those risks. This is an important conversation, especially for parents who may be wondering, what can I do to help my child? So let's get started. Hi, Pat. Welcome aboard. Thank you for being here.
Hi, Denise. It's great to be with you.
Well, let me share just a little bit with our audience about your background. Pat Aussem is Vice President of Consumer Clinical Content Development at Partnership to End Addiction, where she oversees the development of educational resources that support families through every stage of the substance use journey, from prevention to recovery. She has a master's degree in counseling psychology in addition to an MBA and is a licensed mental health counselor in New York and professional counselor in New Jersey. Pat brings hands-on clinical experience across multiple care settings, working with adolescents and adults in psychiatric, co-occurring, detoxification, and residential facilities. Beyond her work at Partnership to End Addiction, she maintains a small private practice, leads community craft family support groups, and helped launch Northern New Jersey's first naloxone training program, which was later adopted statewide. She has spoken at national conferences, including the National Harm Reduction Conference, National Federation of Families, Smart Recovery, the RX Summit, and CADCA, and has created family-focused courses on craft skills, co-occurring disorders, harm reduction, grief, and self-care. At the heart of it all is a simple goal: giving families real, usable tools and a sense of hope as they work to address substance use problems and find their way through complicated care systems. Wow, you are one busy lady, let me just say, and thank you for being here and taking the time out of your busy life to do this.
Oh, it's so good to be here, and it's such a great topic, Denise. So thank you for having me.
Oh, so thrilled to have you. This has been on my radar for about a year. And finding the right person to talk about it is never easy. So I'm absolutely thrilled. So let's start with what really is ADHD for people who have never been diagnosed or don't understand about it.
Okay. Well, first I thought I'd start with a short story, if you will.
Sure. Absolutely.
Many years ago, our community was looking for people to be soccer coaches. I have never played soccer. I did a whole bunch of other sports, but soccer wasn't one of them. But it was for 6 and 7-year-olds, and I was like, how hard can it be? So I got my team of little boys together, and like there was one kid on the team, his name was Ian. I will never forget Ian because he is like that superstar player who just knows how to handle the ball, understood instructions, just followed everything to a T. Then there was this other little boy on the team who sort of went over into the field, plopped down into the grass, was really interested in the dandelions in particular, and especially the ones with the spores on them, where you blow on them and all
Yep.
of a sudden the spores are going everywhere, and just enthralled with that. So that little boy could have cared less about soccer. That little boy was my little boy. And so and he had been diagnosed with ADHD. I don't know, I forget whether it was then or maybe a year or so later. But the bottom line is, it's these kids that really have difficulty regulating their attention, their impulsivity, and their activity level. So it isn't that they can't pay attention. It's sometimes that there's this hyper focus on the things that they really enjoy. So Legos, dandelions, but certainly when it comes to like a difficult math worksheet, that can be absolute torture.
Your story is so interesting because you and I could be soulmates. I did the same thing with the soccer team. They were 4 and 5-year-old little girls. And my daughter was the one, like you're saying too, was not really focused, and exactly the same thing. But I didn't realize it or figure out she needed anything until much later. So just funny. This is really interesting. So yes, well, explain ADHD a little bit and what it is like.
So for kids who have ADHD, as I mentioned, there's difficulty with paying attention. They're the kids that are blurting out answers at school, but they really have a tough time, raising their hand and waiting to be called on. As I mentioned, homework can be really challenging, especially if it's a subject they don't like. These are the kids that are climbing on furniture, wandering in the classroom, and just really having a difficult time of it as compared to adults. So by the time someone is an adult, the behaviors are quieter, if you will. But the thinking part of ADHD, I think, becomes more prevalent. So they might be more restless, might be a little bit more disorganized, might have trouble meeting deadlines. And I know in many cases, at least over the years, the different people I've worked with, often they're job hopping. They can't keep a job for a long period of time. And again, when I say this, these are people that are untreated, right? So I think, someone who is treated for it can have a very different outcome than someone who isn't treated for it.
And it basically is a brain disorder, isn't it? I mean, it's not, you don't really like learn to be attention deficit or ADD, as we used to call it. It's part of the way your brain, your neurons. Could you explain a little bit about that?
Sure. So I think of it as brain wiring, right? So all of us have what is referred to as our prefrontal cortex. So that's the front part of the brain. It's the last to develop. Generally speaking, it starts developing in your teen years all the way through your mid-20s. Although, given today's social media and constantly changing, rapidly changing environment, there's some research that would say it takes even longer to develop. But that's the part of the brain that allows you to pause. People with ADHD have a pause button that doesn't work all the time. So sometimes it works perfectly, and other times it's hard to access, which is why you could teach a kid about safety on Monday and they're running into traffic on Tuesday. It's because that pause button isn't catching the same way that it does for other people. There's a delay in terms of how that develops over time.
And those are the kids that, as they age, you would probably say are more at risk for making, if they don't pause because like they're crossing the street and they're looking both ways, but if there's traffic coming and they don't pause, they might end up being hit. So, I mean, that's just a very small example, but I know that some of the kids, because I have grandchildren now that have this as well, and you can see them just kind of trying to decide what to do and what not to do, and then making the wrong decision.
So I think what really helps is to work with kids on developing that as a skill. So I think of it as a brain wiring that's different and a skill deficit. So teaching the skill about how do you pause is really important. So as an example, some people use hand cues or like a card that says stop on it, in order to just get them to stop for a moment. And then kids with ADHD often have difficulty with lots of different commands. So to say, I want you to go upstairs, brush your teeth, wash your face, get into your pajamas, and go to bed is a lot for kids with ADHD. So breaking things down into smaller steps is important, and then practice the routine. Like you think about a fire drill. Nobody practices the fire drill when there's smoke, right? You practice
Right.
it ahead of time so that it becomes rote. And then the most important thing is to praise the behavior. So it may not be a perfect outcome, but you're saying, hey, Denise, I saw you stop and think there. That was really terrific. And that can make a huge difference in terms of them learning how to stop, think, and pause before they take an action.
Sure, because you're just, completely cultivating that in their mind that this is the right thing, and praise always feels good. So, yeah, that makes a lot of sense to me. Do you tell children at a certain age that they have this deficit, that they've been diagnosed or whatever? How do you approach that with kids?
So I try to stay away from the labels and the diagnosis per se. I think it's more important to explain how the brain works
Okay.
and start with the positives. So there are a lot of positives for kids who have ADHD in terms of their creativity, out of the box thinking, their resiliency, their hyperfocus, their ability to, continue to try things that a lot of adults, and any kids will just be like, oh, I can't do that. I'm going to look silly. They don't worry about that. In fact, I was reading the other day about Simone Biles, who has ADHD, and you think about how she has allowed the characteristics of ADHD to work for her. So think about hyperfocus. So you're in the gym and you're focused on your routine, right? Second part of it is the creativity and out of the box thinking. There are now these amazing gymnastics tricks that are named after her because she created them. Resiliency. So you've got to be able to bounce back after you lose a meet or, lose an award or whatever. And she's the epitome of all of that. So I think there are a lot of great things about ADHD that are important for parents to convey. And then say, but often, your brain, it works fast and it likes excitement and you've got lots of energy. And it also sometimes is difficult to focus. And so the work that we're going to do, whether it's skill development or maybe medications and so forth, are there to help you succeed and, in areas where you might have trouble focusing.
Yeah, well, you did mention medicines, and that is one of the areas that I think a lot of parents get really nervous about putting their child on something to help them focus. And, parents sometimes think every teacher in the building thinks that every kid in the building needs something to calm them down so that they sit and learn their lessons. So I think there is some pushback to that. What has been your experience with, I know every child's different, but, what are your feelings about that?
So I think in terms of medication, you mean?
Mm-hmm.
Right. So I think it's really important to develop a plan that's tailored to your child. And then a lot of it ends up being trial and error to see what kind of medication is going to work best. So there are some medications that are stimulant based. There are some that are non-stimulant based. So it means looking at which ones work best for your child, or maybe no medication, depending on the child. And then coupling that with a lot of support and behavioral strategies, because medication alone is not going to do the job. So it's a tool in the toolbox, just like any other tool.
Sure. Well, and some kids really don't want to be medicated. They don't like the feeling of like being on Ritalin and coming off of it, and that emotional roller coaster that comes with that.
So I think there are a couple things there. One is if you work closely with your provider, and I would always do everything with the provider, because I think sometimes parents will make the mistake of saying, oh, little Susie or little Johnny had a really good day, so they don't need this medication anymore, and they lower the dose. Or things weren't going well and maybe they think they need more. It's really important to have your provider be part of the conversation. So that's the first thing that I would say. And then I think it's important between appointments to really track what's going on. So you're looking at how are they doing with their sleep? How are they doing with their eating? Because some of the stimulant medications can really restrict an appetite. How are they doing in terms of focus, right? And so you consider all of that and then take that information to the psychiatrist or the advanced practice nurse or whoever is prescribing, or your pediatrician. Because I think what often happens is you remember like the last 24 hours and you walk in the door and you say, well, this is what was going on today. And then the scripts get changed or whatever based upon a very limited data set as opposed to looking over the course of the past month. So I think that's really important to consider.
Absolutely. And I think like you said, it should be a professional. Well, I think that's the only way you can get medication, but
Well,
yeah,
no, let me just clarify
no.
that point, because I think there are a lot of illegitimate online pharmacies that sell
Oh,
medications that are counterfeit. And so the concern is, and by the way, there are also a lot of influencers who are suggesting that maybe the medications that are out there shouldn't be used, and they are recommending supplements instead. And by the way, none of the supplements out there are regulated. So it's not like the FDA, the Food and Drug Administration, is looking at those supplements. So I think it's really important for parents to talk to a provider who is trained in terms of knowing, what the dosage is, what the side effects could be, how to modify it, and then and to get any medications from a legitimate pharmacy.
And I think I'm just remembering when my oldest daughter was started on some Ritalin. There's a little bit of supervision and oversight that needs to happen with that. She went through a spell where her heart was racing, and we had to get in like a catcher's position to slow her heart rate down and that type of thing. So to be doing that with somebody online, sending something to you, that's frightening.
Yeah, I think it is much more difficult. And I do think, especially with kids, it's good to eyeball them and see how they're going and talk to the child, not just to the parent, but to the child about how is this working for you?
Hmm.
I know in my son's case, his appetite all but disappeared.
I know.
So we would have a really big breakfast because I knew he would eat a really good, healthy, hearty breakfast. Because he wouldn't eat a lot during the rest of the day. And that was, again, something that we talked to the psychiatrist about.
Yeah, that appetite suppressant part is really difficult. I remember that with all of my children that have this as well, that they became very thinner than they had been, and then you're just worried. Add another worry to everything else that you're worried about. But, as I always say on these shows, every parent is not created equal, and every parent comes from very different backgrounds, and including educational backgrounds. So, what would you say? I have one of the ladies on my coalition is a therapist, and she wanted me to ask you this. How do you handle it when you have parents that come in with the child? They know there's issues. Particularly, maybe they've gotten into some substance use, and we'll talk about that in a minute, more risky behavior. And they don't believe in mental health therapy. They only believe in parenting maybe the way they were parented, with a lot of tough love. And how do you break that barrier?
So I can appreciate how a parent might feel concerned if they felt their child was being labeled with a mental health problem. For many parents, mental health carries stigma, or they might think it's a verdict on their parenting. So I try to steer away from that per se and really focus on the behavior. So talking about, what behaviors are you seeing? And I think most parents can recognize when their child is struggling. So, they're having difficulty at practice, they're having difficulty in school, they're having difficulty at home, which, by the way, is another hallmark of ADHD. It's important to look at the way it manifests across settings. It's not just, you're in one classroom and you don't like the teacher or whatever. In any event, and then I would say, and how is the way you're parenting currently working for you?
Dr.
Right?
Phil,
So
how's it working?
how's it working? So really asking questions about, are there more meltdowns? Is there more yelling? Are you trying to punish? Trying to punish an ADHD kid for a skill deficit would be like punishing a kid who hasn't learned algebra for not knowing it.
Right.
So then then I usually go to, would you be willing to try a different approach for a couple of weeks? Let's try. And then I would give them one or two things to work on and say, let's check back, in 2 weeks from now and see how is it going now? And is that working? So, there are options other than tough love or no love, right? And then the middle one that we know works is really helping these kids develop the skills they need in order to be productive, effective, thriving adolescents and young adults.
That makes sense. Well, is there anything I'm not a therapist and I can't imagine that role, but if, you had parents that came in with the child and, maybe they asked the child to leave the room for a minute to talk to the parents, how do you get over that hump of that they don't understand? I get it that if you say you have a mental health issue, that can be stigmatizing, unfortunately, for some parents, but how to get past the fact that they love their child, they want their child to succeed. What would you say to them?
So I think, we're not trying to label the child or anything like that, but I think what we're trying to do is figure out, how do we get the right help the fastest? And so whether you want to call it ADHD or just a problem with focusing and concentration and so forth, or academics or whatever the main reason is that they're struggling, let's focus on the behavior change. And then hopefully, if you give them some things that are easy to take away from that session and implement, they'll come back and it'll sort of be the dawning of, oh, there's this other way to do it. I think many people grow up thinking that whatever their parents did is how you should be raised. I mean, that's very natural. I often say to my friends, I kept looking for the handbook that was going to come when I popped the babies out, and there was no, I don't know about you, but I didn't get the handbook. I lament that. I think people get more training on how to drive a car than we do about raising kids, unless you're a voracious.
So true.
Right. You got to be a voracious reader and, talk to a lot of different people and trust the team around you. I mean, I think that may be the other thing for parents. It's like, maybe there are other trusted adults, or a coach or a teacher or a guidance counselor, somebody in the mix that could be an advocate as well. And sometimes that helps. Or even talking to another parent, going to a support group and just saying, hey, why don't you try CHAD, which is one of the support groups for ADHD, and maybe there'll be some ideas there that might be helpful for you.
I agree with that because I've always learned so much more from parents than and one-on-one kind of thing than ever what a doctor would say or whatever. I mean in general, not that doctors don't say intelligent things, but I'm just saying, but talking to other moms, you learn so much of what works
Right.
and what isn't working. So that's great advice, honestly. But more than children that are like, we're talking about little kids. Well, I was talking about little kids and getting started and trying to get them diagnosed if they need it, and some working strategies for them. But when they start to get into puberty and past and into early high school, I think things become somewhat more difficult for the child, being that their prefrontal cortex with their decision making skills can be more difficult for them when choosing not to do risky behavior like some of the substances. And so can you just sort of hit on that as to what that looks like and what parents can be on the lookout for to make sure? I mean, it's probably the same as for any child with worrying about getting involved with substances, but for them, I think it can be more risky.
There definitely is an elevated risk. Although that said, we did a really interesting study with a woman named Dr. Stacy Sterling. She's out of Kaiser um, Permanente, and she had done a data mining study looking at 40,000 records of kids from the time they were born until they were 18 to try to determine who was more at risk for substance use disorders. And and also she had the mother's records. For whatever reason, she didn't have the father's records. But the most interesting thing out of that, I think, from an ADHD perspective, was assuming the kids were treated early. So, before their puberty, teen years, and so forth, they were at no more risk of developing substance use problems than any other kid. So I think that's the good news, is that treatment can be really protective. And but then, there are going to be some kids that are looking to experiment or try something. I have heard kids who have used marijuana say it helps quiet their brain,
Yeah.
and things like that. So first of all, I think it's ongoing conversations when kids are in late elementary school, before they get to middle school, about the risks of substance use and what that can lead to. So I think that's the first thing that I would say that's really important. And I think that, obviously there are other protective factors, like having your kid feel like they're really connected at school. And sometimes for ADHD kids, that can be more challenging. So maybe there's an adult at school that could be a mentor, or maybe there's a kid that's older that could be mentoring and things like that. Sometimes that helps. And for some kids, having an individualized education plan or some kind of plan just to help them really succeed at school can be really important. And then pursuing things that may be considered risky, but they're healthy risks, right? So I know for my boys, because both of them struggled with ADHD, team sports was not their thing. They tried to play team sports. They just didn't do well at it. But doing, skateboarding, snowboarding, they're the kids that would want to go bungee jumping. So it's like finding the things that you can do that are healthy risk taking, I think is the most important part that parents can steer toward. If there ends up being a substance use concern, there are different strategies that parents can use. That's where the work that we showcase on our website at drugfree.org called CRAFT can be really helpful. So CRAFT stands for Community Reinforcement and Family Training. And the idea is, how do you have conversations with your loved one about substance use without it imploding or without them rolling their eyes and saying, "Oh, mom, you're making a big deal out of this." And then there are behavior management techniques that can be really helpful too. So, how do you reinforce the behaviors you want to see more of, i.e., the healthy risk taking? And how do you set boundaries and consequences for those that you don't want to see? And then I think, if things still don't progress the way you'd like, it may mean getting professional help. So, going to a therapist or someone like that who could help you. The one thing I would say is that not all therapists are trained in addiction and substance use problems. So making sure that whoever you are working with really knows ADHD and really knows substance use is really important.
Well, that makes a lot of sense, but that's good news that the children that are treated or have figured things out aren't at any higher risk, because I think that is one of the ladies on my coalition. Her son, he has ADHD, and I think she's very, very nervous about that. One of the other things I was wondering about is, since I mentioned my three daughters have had at some time in their life been diagnosed, one severe, not the other as much, but now they're raising children that have ADHD. When you are a parent yourself with it and you know some of the things, does that make it easier or harder, do you think, then to work with your own child?
Oh, that's such a good question. I suspect it's both. It's a little of both. It's sort of like, what to expect, what the concerns might be. And then you worry about, I think as I said a little while ago, perhaps before we started, that, I did a lot of reading when my son was diagnosed with ADHD. And I think that's important, right?
Mm-hmm.
For any difficulty that your child is having is to learn as much as you can about it. And some of that, some of the research that I did was frightening, quite frankly. And so it's like, okay, I realize that there are these concerns about the risky behaviors and so forth, but I'm going to do everything within my control to try to address it and to try to ensure that we have the best outcome possible.
So when they say it runs in families, which I'm pretty sure might be correct, doesn't mean it's hereditary exactly. Is that right?
Well,
Or is it?
generally speaking, there's a risk level, right? So that if there are any kind of, just like there's a risk of different kinds of cancers running in families, and depression runs in families. So it generally means that there is some kind of genetic component, but genes aren't destiny. And so really trying to put the right, develop the right skills to have the right environment and the nurturing in place and so forth can really make a tremendous difference. And quite frankly, even if there is a substance use problem that happens, it doesn't mean that that child is going to have a lifelong addiction and so forth. It means that it needs to be addressed. And there are very successful ways of addressing it.
Yeah, that. I'm beginning to learn more and more about it, and looking back, it's kind of funny once you start reading and learning about this, that you look back on siblings growing up and, my own husband, who can certainly hyper focus on something. And I think, I wish I would have known that, would have treated things differently.
True.
That is
Very
just,
true.
that is just kind of interesting. Do you think that with all, you mentioned this earlier, but with all the social media and the constant screen changing that they're doing with their eye movement, do you think that this is adding to the number of children who have ADHD or not? I always wondered about Sesame Street with my oldest. The Sesame Street wasn't like watching a cartoon that started at the beginning and ended at the end. Sesame Street was constant bombardment of little things here and there, depending on, Count Dracula and he's counting, and then they moved to the next thing. I always thought, I wonder if that made her that way or contributed, I should say.
Right, right. Um, Probably not, but
Probably not.
well, we're not going to throw Sesame Street under the bus. Um, but I do think there's something to the constant change of focus and attention with social media, so that and studies are showing that it's more difficult for kids to focus and to remember things because it's instantly available with your phone. So does that rise to the level of ADHD across the board? No, it doesn't. But it certainly is concerning. And quite frankly, I applaud the school systems that are looking at restricting phone access in school. For kids that are under the age of 16, I think it's a great idea so
I
that
do
it's
too. I
back to
agree.
learning the way without being impeded by social media and other things.
It's interesting what you just brought up, though, about that they can look up something immediately on their phone or their laptop or whatever, instead of like thinking for a few minutes and trying to recall that information from a class that they took or something like that. You're sort of bypassing the training that you need sort of for memorization or long-term memory. I mean, I would think to a certain extent.
No, I think it's really interesting because there's a part of the brain, the hippocampus, and some other parts that are really important for memory.
Uh-huh.
And so the more you try to memorize things, like the times tables or memorizing different passages or poems and things like that, that
Mm-hmm.
seems to be a skill that has gone by the wayside because people can recall, just use their phone or whatever to bring up information. So, and that's actually, it's another thing that I think is really interesting. There was a psychologist on the television the other day who was talking about boredom, and so that the phones and being able to doom scroll has addressed boredom in our culture, and that boredom is the petri dish, if you will, of generating ideas and creativity. So his recommendation is to let yourself be bored every now and then so that you can come forth with interesting ideas or thoughts or what have you. So,
And you really notice that at the end of the summer before school starts, that the kids have, they've done all the swim stuff, they've gone to the amusement parks, they've done whatever that they could afford to do. And now they're bored. And now they're just hanging around. And when my kids were young, that's when we did crazy tie-dyed t-shirts and you name it. We used to do every kinds of crazy things. But so many of the kids get really fussy, I would say, or out of sorts when they're bored. But then if you just let them be bored for a little bit, they're building a camp in the woods or they're,
Mhm.
doing, and I think that's so true and so valuable. Um, and we've just gotten kind of past all that. I was at lunch with my granddaughter the other day. She's 10. And we were counting the people in the restaurant that were on their phones. Now, they were mostly adults, but they can't even sit there and just hear their own thoughts or read a book. They're just constantly scrolling. And wow, that we've come to that is frightening to me, particularly for the kids. But
No,
even for the elderly, it's kind of crazy.
no,
I don't know.
I would agree with that. But speaking of school too, I think back to the topic of ADHD, I think there's some things that the schools can do that would really be helpful. Um,
Yeah.
so exercise. And I know like a lot of schools cut way back on recess, but these kids need recess, or they might need the ability to like stand and pace in the back of the classroom. So I think that can be really helpful. And I've even seen some studies, although I don't think there are any definite conclusions, but that standing in the desks that rise up so that you're not just seated all the time, but that can rise up so that you're
Mm-hmm.
standing can be helpful. I think where you put the kid in the classroom is really important. When I
Yeah.
was a child, my maiden name started with a Y, and we used to be seated alphabetically. So I was always in the back of the class, which was fine for me, but not fine for an ADHD child.
No.
They're better off being in a place they're away from the windows, so they're not watching, the birds fly by or the guy that's landscaping outside, and probably near the teacher, so that those hand cues that I mentioned before about so that you pause and think, they can actually see the teacher, maybe give them a hand cue. And I think, routines are really important because routines take the guesswork out of impulse control. It just,
Mm-hmm.
and the more they're repeated, I think the better. Certainly some teacher training to understand that, this little child is not being disrespectful. They just haven't learned a skill yet. And so we're going to work on them with the skills. And then I know in working with my own children that we did a lot around organizational skills. So we had different color-coded folders for every topic. So, English might have been a blue folder and math was a red folder and history was a green folder. And homework went in the right side and completed homework went in the right side. And, stuff that they had to do was in the left side. And I used to use an egg timer a lot. And so that when we were going to transition from one thing to another, I gave them a 5-minute warning. And so we would turn on the egg timer or flip it over or whatever. And that way they knew that, something was going to change. And I also partnered a lot with the school over, do we have to do 20 pages of a math worksheet because we're spending hours at the kitchen table
Mm-hmm.
through this? And, can we use something less than that to show proficiency? And they were very accommodating. And at one point, we actually, for one of my children, we had an extra set of books at home, so that we weren't worried about losing books and that sort of thing. So there are lots of things that can help if a parent will avail themselves of the team, right? And I think of the team as, your partner, maybe other adults at the school, whether it's a coach, the guidance counselor, a teacher, et cetera, can really make a difference.
And I think that's so important for the parent to reach out and not feel isolated. That their child is the only child with this kind of a problem, and
Yeah,
they're embarrassed or they don't want to go talk to the teachers. Or the teachers are there because they want to help. In general, they really are. And my daughter's a 5th grade teacher, and she always gets the most difficult behavioral children, and but they know that because she can handle that. In her classroom, we couldn't understand this initially because we'd go help her move classrooms sometimes at the end of the year if she needed to do that. And we grew up in regimented Catholic school where the desks were all lined up and
right.
front to back, the whole usual thing. And now there's this furniture that has swing things at the bottom. There's jumping thing, kind of like you can jump up and down. And my husband and I are like, how would they learn with this? She said they actually learn better. So it's good that this has been recognized, even though old people like me have a hard time understanding it initially. It does make sense if it works for the kids. Well, you've given some great advice. If you had one thing, though, that you wanted to say to the parents of kids that have been diagnosed with ADHD, because you've covered so many wonderful things, what would you like to leave them with?
First of all, breathe, take a deep
Breathe.
breath. It's okay. We're going to get through this together. I think that there are so many things that we know today that we didn't know perhaps when certainly when my kids were young, or perhaps when your kids were young, that can really help. And and I would surround myself with people that are on my team. I wouldn't try to go it alone. So whether I'm using support groups, or using my pediatrician, or talking to a guidance counselor, or maybe I get a therapist, but there are a lot of people you can bring into it who understand. And, this is not a judgment about you as a parent. This is your kid's brain was wired a little bit differently. And by the way, back to the Simone Biles thing, I mean, you can be wildly successful and still have ADHD using the things that make ADHD kids special. So
Their creativity has been, documented that they tend to be way above average IQ, and I think that's probably very true. So I guess look at the good news. They're super smart. You just have to figure out how to challenge it, or channel it, I should say.
Yeah.
Yeah, and figure it out. You've given such great advice. Let's talk just for a minute, though, about Partnership to End Addiction, because that's so powerful and such a great website. Can you just give us a little bit about that for parents to go to?
Sure. So the whole idea, if you think of the name, is that we believe that we can prevent addiction. So it starts with really good building really resilient kids to start with, and we know that, at least from a substance use perspective, the longer kids delay use, while that prefrontal cortex, the pause button, is being developed, the better, and that the risk of addiction goes down dramatically, and that there is effective treatment if someone has a problem. So the entire organization is really built around, providing information to families, so that wherever you are, if maybe you're trying to get ahead of this, that there's a family history of a problem of some kind, and whether it's mental health or addiction or what have you, that you want to get ahead of that. And so here are the things that will be helpful in terms of the prevention space, if you will. Or maybe you found a vape pen in your kid's backpack and you're like, okay, I don't know what to do with this. Or, we've even worked with parents who, as an example, a daughter is pregnant using IV heroin. So all along the range, we've got support resources to help you. So whether it's learning about a substance or learning about different parenting skills, it's all at drugfree.org. And it's free, and much of it is in Spanish as well.
It's just a wonderful website with so many tools for parents and so many things to make them not feel like they're fighting this alone. And I think that's it's just amazing. Well, we've come up on a hard stop. I can't thank you enough. You have been amazing, so calm. And I think that the things that you have said will make a lot of parents feel a whole lot better about their child having ADHD, and give them some really good tools to move forward with helping their child. So I can't thank you enough for being on. You've been great. And I appreciate it. And we will have all of the website and everything in the show notes, and they'll be able to access it from there. So thank you, Pat.
Thank you so much for having me, Denise. This is great. Thanks so much.
Thank you. Thank you so much. So special thank you, obviously, to Pat Aussem and Partnership to End Addiction for helping us better understand the added risk that children and teens with ADHD may face, and what parents can do to support them. The message for parents is an important one. Knowledge, connection, and early support can make all the difference. Understanding your child's challenges and having open, ongoing conversations can help you recognize concerns early and take action when needed. If you found this conversation helpful, please share it with another parent, caregiver, educator, or professional who could benefit from this information. This podcast is on YouTube and Apple. Please consider subscribing to our channel. And remember, you don't have to wait for a problem to develop before you start the conversation. This is Step Up to Save Our Children, and thank you for listening. We hope we'll see you next time. Thank you.